that area to do some good loosening up. And then I might take my thumb saver and just say, let's follow the three strands, three components of the infraspinatus as it travels out here. Kind of looking for an active trigger point. Travell says there's 3 trigger points right in there. Again, I would be just a little bit higher for my own body mechanics with those fibers, and then coming around searching, being thorough, and searching, and then going to the next strand, and then remembering the border of the scapula, just on top of the scapula, from the border. If I go one finger with there, what am I on? Teres minor. Teres minor on the scapula, and it can be a wicked one. There, right down to the point of the scapula. There, and I'm always watching her eyes to see, even if they're closed, I'm watching to see if she squinches and does what. That's the thing to watch, is the eye. That's tight, right there. Sometimes the most important thing that happens is the therapist takes a breath. Remember that.
That's what I encourage my clients to do. I'll take a big breath.
I'll take a breath with her. You bet. I'll say breathe, or I'll just lead by taking a visible breath. And she'll fall in with me quite often, the client will. So you go with the fibers of teres minor and then across the fiber a little bit. And yes, if you want to grip or grab, you can grab that complex of teres major and lats right up in there. You can take a big handful in that way. I'm not using my thumbs. If you want to use thumbs, you could easily squeeze with thumbs, but I'm not. So I can have a place like that where I can grab the whole apparatus and do some rolling of the area, some lifting and rolling of that knotty stuff right there, Susan. And then remembering where the humerus is, roughly where the seam is. So now I'm on scapula, 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 and now I'm on humerus. It just changes that quickly. So easily to do tendons, as I did before, to show it again, working with tendons and cross tendons, and try. Very few cases where I would ever recommend doing anything like that fast. I just don't recommend it. I recommend like a windshield wiper, so I'll often go to imply the wider swath, if you will. So be cautious not to take your thumb or this instrument and be doing things like that. Please. I don't recommend it. I can't tell you that it's absolutely wrong, that you'll hurt them, but I have found it to be less effective. Let's put it that way. Whereas here, I can say breathe, and she can fall into my rhythm. I'll have to stand again because I'm in core body mechanics. The other finger is always there as a guide. Always there, leading the way, showing the way as the operator finds. And what do we got, Susan, right there? What's that like? Is that a tender spot?
Not too bad.
Not particularly. Okay, sometimes a hard spot to me will not be tender to her, and sometimes I'll be right on.
Right there you're getting on it.
Pardon me?
Right about there is you're on it, though.
Yeah. And notice the other fingers on the body for stability. I don't try to use this in the air. My hand might waver or wiggle or something, but here, if I've got stability, then it helps me to be stable. And I can use it just that way, and there's the guide. So again, forearm over the scapula and in the complex of the teres major, teres minor. I don't see any reason why I couldn't reach back there if I'm artful enough to find the spot. And I'm not using the point of the elbow. I really am not. Other than I'm not purposely digging it in. I am now. But right now I'm just prying her back and giving her some leverage. Now how easy that is. It could be a very large person on my table, which it isn't, and I could be delivering a good piece of work. By stabilizing.
Is that serratus?
I'm not trying to stretch. All I'm trying to do is stabilize, because if I do that, she might get the fear of falling. But with me stabilizing her here, she's not going to have the fear of falling, I don't believe.
And what do you
I'm hooking. Look what I'm doing.
We can't tell what you're doing.
Oh, you can't
That's
tell.
what we were
I'm-
asking.
I'm hooking back into the lats and Terry's major.
Right under the
Right in
lat.
there.
Okay.
Right in there. And this brings up another item. May I have a towel, please?
And it is kind of a stretch, even though you don't intend
Yeah.
it to. It opens up here. Shut up, go back.
A big towel.
There's one right under the front of your demo. Oh, there's one right here.
Right here. Thank you, I have it. That's too big. Sort of too big. That's too small. That's just right. That's just right. Just call me, go on. If you have a client with a shoulder injury, shoulder problem, they might not like, or they're elderly, older than this one anyway, they might not like that. You might say, oh, or you put it there and they'll move it away because it hurts because of the stretch on the shoulder problem. And it might happen on a mesomorph like Susan with the tight muscles that you generally have. She's in one of them mesomorphs. See? So, how about the simple placement of a spacer there to allow that to be a little more comfortable? A little harder for her to hear me, and I can talk about her now. But it does open this up, and it also puts it on slack if it's tight. So I'll reach in here and do a little with the fibers, with the forearm, making it easy on myself. I'd like to hear the word from you. Two things I want to hear from my client. One is, I'll buy lunch. No, the other one is the number of where I'm at, 4 or 5. The other word that I like to hear is the word, and I'm asking her for that right now. Can you hear me, Susan?
Yeah.
I'm asking her for the word there. It lets me know as I'm going along. I mean, I'm finding different things, and I want to hear that word from you, Susan.
Okay.
In other words, I don't like it when a client comes in and says, okay, I got some spots, see if you can find them. You know, that
Yeah.
kind of, you've had it, haven't you?
Oh, yeah.
You know you have.
Oh, yeah.
Where they say, well, I figure you know what you're doing, you know,
Right.
and if you're good, you can find it. Well,
You'll know where they are.
yeah, I mean, come on, what kind of
I'll
logic
find
is
something
that?
you didn't even know.
Right. So, I've got a good idea here, but I like her feedback. I value her feedback. So I want to know what's important to her. Like, is that one tight? Is that one it's in there? Or is it there?
Right there.
Okay. So now I'm just see me leaning in fairly well there. No strain on me. And even my spine is pretty straight. I'm in the front bow position. My elbows are thoroughly supported by her body. And that was the breath, nice breath, usually implying that she's releasing. So fine, I'll take that as a partial release at least and move on. And the earlier move was this one, just hooking in just a bit. Right there, and there, and there, and there. Modest pressure. You'll notice that I didn't just give it everything I have. I can do a lot more, but I'm just, how you doing?
Good.
Okay, what do we got? What number we got here? Okay, good. Let's breathe.